Hello and welcome. I'm Britt Myers. Thank you for being here with us for this conversation. Today we're sitting down with Bret Moore, psychologist, Army veteran, author, and someone who's spent really his career at the intersection of trauma and transformation. And Josh is here too. Thanks for being here.
Thanks, Britt.
You're welcome.
I had nowhere else to go, so I appreciate it.
Yeah, this table is a good place to start.
Yeah.
Bret, okay, going back to the early days of you and your career, why the military? Why psychology?
Because I didn't know what else to do, right? So when I was training in my academic program, one of the final steps as a psychologist, you have to do an internship. You have to go do some clinical work, get supervision. I had no idea what I was going to do, and this was shortly after 9/11. And I remember watching a newscast, and I saw this guy in a uniform standing in front of an Army tank. I'm like, what is this guy talking about? I had it on mute, and it was the news. Didn't really care, really. But then I turned it up, and come to find out he was a psychologist. And so I had no idea psychologists were in the military. And I thought, well, that sounds like an interesting way to practice and an interesting environment. So I went down to the recruiter's office. They tried to sign me up as a specialist. And I was like, wait a minute, that doesn't seem right. So I'm pretty sure that, you could go in as an officer, as a psychologist. So I found the right medical recruiter, and the rest was history. I didn't want to work in a university, at least at that point in my career. I didn't want to work in a community mental health center. I didn't want to do private practice. I really wanted to work in a unique an expansive environment, and that was Army psychology.
What was that experience like for you? Because you pretty quickly went over to Iraq, right?
I did. So right after internship, I was actually in Iraq before I was licensed, and fortunately they don't do that anymore. But within 6 months of moving to my first duty station, which was Fort Hood, Texas, we went to Iraq for 12 months and came home and for about 9 months, and I went back again for another 15 months. And it was, I always say the best two things I've done in my life, there's a lot, but two things that really stand out is joining the Army was a good choice for me, and getting out of the Army was a good choice for me, because if I wouldn't have gotten out, I wouldn't have been able to do the work that I do now. But if I wouldn't have ever gone in, I would have never had the opportunity to do the work that I'm doing now. It's paid off dividends for sure. It was a hard stretch for 27 months deployment, but it made me a better person and a better psychologist.
Bret, although Britt likes to fact check me sometimes, I do want to fact check one thing. My recollection is at one point you were the longest deployed Army psychologist in American history. Is that true? At
one point I had the most months. I was surpassed by some friends and colleagues. But yeah, at one point I was told I had the most months logged in a deployed setting as a psychologist.
Have you thought about going back to take the record back?
No, I have no desire. No, I don't. That was a long time ago. I was in a lot better shape.
Ronda Rousey's like coming out of retirement.
Well,
so you
I
never
saw
know.
that. Yeah,
so.
There's still time, just saying.
Well, maybe we'll see. We'll see what happens. Don't count on it, but we'll see.
Yeah.
So.
Well, when you are sitting down with service members in that environment, particularly who are, not to minimize it, but obviously going through a lot, what was the goal of, don't want to use the word treatment, but what was the goal? Was it about, at that point in your career, we're not at the PTG phase yet. So was it mostly about minimizing symptoms? Was there room to have conversation about meaning making or transformation, and just kind of talk about what that phase was like?
Yeah, so I was part of what is called a combat stress detachment, or a unit. So our combat stress control. So our mission was to keep the men and women in the fight, right? So it wasn't treatment. It was a lot of prevention. So my primary mission was to help the men and women that are putting their lives on the line to be able to function at that level that they need to be safe and to be effective. It wasn't to rid them of their symptoms. It wasn't to return them home so they can, go back and be part of a mental health clinic. It was to keep them in the fight. And I really loved that mission, right? So, but it was a hard mission, because as a psychologist, I want to help people. And the idea, and I struggle with this at times, my goal was to send them back to a situation where I was pretty sure they were going to be traumatized again. Yeah. But I met some other more senior Army psychologists that helped me understand that actually helping them maintain that mission and that purpose was actually probably better than sending them back as kind of a broken individual because of their combat service, is that they forged that strength and resilience to keep doing what they were trained to do. And that was actually kind of a saving aspect of their well-being.
Yeah, that's really compelling. I mean, you had talked about this a little bit in the roundtable episode, but just want to dive into it a little more here, which was, as a psychologist, you had spent maybe the first part of your career, a better part of your practice, not really talking about post-traumatic growth. Do you remember when you heard that term and kind of what that was like for you as somebody who's so deep in this field?
Where I came to understand post-traumatic growth, I was working with a young soldier in Iraq, and he had a difficult experience, several traumatic events, what we would consider traumatic events. Met the criteria for PTSD, and was really struggling, right? And then I met with him. I did what I did at that time as a psychologist, checked the symptom boxes and the check boxes, and said, okay, looks like you have PTSD. So we started a treatment called prolonged exposure, which is a very common treatment for PTSD. And as I was trying to deliver the treatment in this certain structured, manualized way, he kept interrupting me and say, listen, I understand what we're trying to do here. I get what we're trying to do and what you're getting at, but I want to tell you about some of the things I've noticed in my life that are positive. I was like, okay, well, maybe we'll talk about that later. I was naive. I was young. I was inexperienced. I don't think I was dismissive to what he was saying, but I was trained in a way that says, keep them on the protocol, keep them on the manual, regardless of where they try to take you. You're in control of the session. You try to get them through the protocol. And, that I did that for a bit. And finally he said, listen, you're not listening to what I'm saying to you, right? So I want you to hear me. I want you to hear what I'm saying. And he started talking about how he developed this deeper connection to his father, the very strained relationship prior to him coming on what was his second deployment at the time. And he was able to attribute the growth and the connection with his father to his traumatic experiences, and how he had developed a sense of connection, not just to his father, but other people because of his traumatic experiences. And I was like, what is this? I've never really seen this. Is not what I expected. So like anybody, I get on Google, search try to come up with some terms, and I came across post-traumatic growth. And I emailed Rich Tedeschi and Lawrence Calhoun, and Rich was the first person that responded to me, and we struck up this conversation, and he sent me some information, and we developed a friendship. And that's where my professional career changed, right? Now I knew something that was different than what I was taught in my graduate training that resonated with me as a person and now as a clinician. And it really changed my practice early on in my career.
I didn't know that about you. And I just want to say, personally, I admire that you could have just ignored what he was saying to you, or you could have listened to him, as you were trained to do, and then just kind of continued going about the approach that had worked for you up to that point. But I just really respect that you heard what he was telling you and that you dove in even deeper, and then beyond that, used that to transform your practice and other people's lives because of it. But.
Yeah, it wasn't. I was a bit hard-headed. He had the third or fourth time he said, "Listen, he said some choice words," and he said, "You're just not listening to what I'm." He was respectful.
Words?
I thought you were talking about Rich.
No, no, not Rich.
Just wondering about the email. You're not listening.
I just want to hear what the words were.
Yeah, no. So he was. I think he was probably a sergeant at the time. I was a captain, and he was respectful, but he was very forceful in that. Doc, you're not listening to what I'm telling you, and he had to say that 3 or 4 times because I was not listening to him. And that was one of the early things I learned too. Is I need to listen to what these people are trying to tell me that are sitting across from me. I'm not the expert. I'm not the expert on their life. I can't fully appreciate what they've gone through and what they're dealing with. So I need to listen more than I talk. And that was an early lesson too.
And Bret, just take us into those sort of initial dialogues. You mentioned Rich sent some stuff, but I'm curious, you see it, you email, I don't know, I guess professional courtesy would suggest that people be responsive. I don't know if you were surprised by it, but then what was that back and forth like? And then how did that impact? Because I assume you were still in Iraq at the time.
I was in Iraq at the time. We had limited access to email. We had some, But I remember thinking, he's not going to respond. All right. So this is, and because I didn't know Rich at the time. Hopefully that's not a shot to his ego.
You knew his
wherever he
celebrity
is.
status.
Yeah, but I came to find out really quickly his celebrity status, because if you type in post-traumatic growth, his name pops up everywhere. I was like, this guy's not gonna, his knucklehead.
Wouldn't with that byproduct name, he said.
That's right.
That other one
Yeah,
wasn't.
positive byproducts was the other alternative. Yeah.
But he did. Within 24 hours, he responded and sent me some information, and then we struck up I don't know if it was a friendship at that time, but it was very collegial. And then when I got back from Iraq, we connected a few times. He came out and did some trainings for the agency I was working with at the time, and then we hooked up at a conference, an annual conference one time, and we struck up a friendship. And it was, but because of his kindness and his compassion and empathy and his giving nature, it was not a big deal for him to respond to my email, but it really took my life into a different direction. That response to a simple email changed things for me profoundly, which hopefully has changed things for other people that I've encountered in my life.
No doubt.
And then were you able, because obviously you're trained, you're pretty young, you're doing this work in Iraq, you have this experience, you get some insight. Were you able to start to apply that when you talked about kind of this realization, like the self-reflection, self-awareness, like, I'm not really listening, Joe, this gentleman is right. Were you able to start to use that relatively immediately as you were doing more work, or was it?
Not so much. I mean, it was because it was a different environment, right? So you're basically trying to patch people up psychologically and getting them back. That was not the time to where you want to start exploring these more esoteric concepts, right?
Yeah.
These constructs that maybe aren't that fully developed from my perspective and my understanding. So no, it wasn't until I, got out of the Army and started working with Indian Health Service. I spent a couple of years working on a Native American reservation, and where you talk about trauma, a population that's truly traumatized, the Native American population, especially young women. I developed a deeper understanding of this sense of growth, because I would see it in the men and women that I would work with on the reservation.
Mm-hmm.
And I did that for a couple of years, and then became a civilian working with military members again. And in the early days of the wars in Iraq and Afghanistan, so I saw a lot of trauma coming back from the wars, and again, it just shaped my whole professional career. Yeah.
And then was your military experience in the combat stress control work, how instructive was that for the work you were doing in North Dakota?
So interesting enough, I actually chose to take that job on the reservation because I was kind of burned out dealing with trauma.
Mm-hmm.
And I wish someone would have told me that I'm going to a place in Montana, frontier living, which can be traumatic in itself. And I grew up rural Mississippi. That's different than frontier living, right? And that's kind of what I was exposed to. But the population, the level of trauma in that population was just immense. And I worked a lot with kids, and I had never really worked with kids that had dealt with significant trauma in the past. So I just burned myself out even more, I think. But I enjoyed the work, and it helped shape my work today. So I'm glad. There's been nothing in my professional life that I look back and think, man, I wish I wouldn't have done that. It's all led to where I am right now.
Yeah, and I don't want to put words in your mouth, but it is interesting because I keep thinking about the realities of when you were in Iraq. You kind of touched on this briefly, but then again, you said Montana.
Yes.
Okay.
Mm-hmm.
You're talking to two groups that they're not like removed from this traumatic event. And I mean that it's not that they've had to endure something and, maybe they live in another state now and they're like trying to process through what happened to them or this loss they had or whatever. It's happening in real time and recurrent. Like, how do you just even approach that? I'm just trying to think about, like, you have somebody sitting in your office with you and you're about to send them back out into an active war zone. Like, just how do you even handle that? And the same thing on the reservation in Montana. It's like they're not going to suddenly be pulled out and removed from that. They're going to be dealing with that struggle in real time as soon as they step out.
Yeah, you struggle. I struggle with it morally, right? I mean,
Mm-hmm.
why am I doing this? What is my role? This is not what I trained to do in grad. I never thought when I was training to be a psychologist, that my primary mission was to send people into harm's way.
Mm-hmm.
I mean, I'm not sending people necessarily into harm's way, but I do have the ability, if I sign the right document, to say, go back. You go back to Germany, back to the States, wherever. I can get you out of this environment. But that wasn't my job, right? And sometimes it was, right? If someone truly can't function. But my primary job was to keep them in the fight. And morally, that was difficult for me to. I wrestled with that. But again, I had some senior people in my life tell me that you have to look at it from the perspective, this may actually be the best thing for them, right? Because what happens if you send them back? What does that do to their psyche? Are they going to feel like a failure, that I let my brothers and sisters down? And, am I going to recover from this? Am I going to be a broken person for the rest of my life?
Yeah.
As opposed to the person goes out, completes his or her mission, and then has a sense of pride and respect for what they did. So part of me, in the way I sleep at night, is that, I think that was probably more of the case in my situation, is that I did more good than I did harm.
Yeah, I mean, and I think that although these things are always complex, it's like that, from all the stories we hear in Warrior Path is like, and then plus they're separated from their unit and they lose all the camaraderie and the connection. It's just, there's a lot to it, that these are not simple choices.
Right.
One of the things from a military perspective, and there's an article I love in Defense One by a couple of senior Air Force, so one enlisted, one officer, that talks about sort of this catch-all term resilience that's been put on all these things that doesn't really mean much in the military context, much less in the broader context. And so I'm curious, can you speak a little bit to that concept of resilience, the ways in which it's different than PTG, and I think maybe, I don't know, a little bit about what you think would be helpful for the rank and file in terms of, as they're navigating life and what is obviously a dangerous world.
So when I think of the term resilience, I think about the original intent, which was used by engineers, right? The where you build something and that it can withstand wind, water, earthquakes, that hopefully it will return to its original shape, right? So that, to me, that's resilience. When I really think about that, when you apply it to the field of psychology, it's about returning to baseline. And that's not bad in and of itself, right? Returning to baseline after you've experienced a traumatic event or a difficult life experience, again, that is a good thing. But it's not the same thing as post-traumatic growth, which is a transformative experience, right? That, yes, I think we all have the ability to bounce back, and people say that oftentimes when they talk about resilience, but they don't understand we have the ability to actually grow as a result of our struggle with that. Resilience is only part of the story, right? What I think is more exciting and rewarding and fulfilling is this idea that suffering is not just for suffering, right? There can be purpose and meaning in our suffering. And that's not me. That's decades of religion and wisdom literature and a lot of smart people talking about what can happen as a result of trauma. It's not either or, resilience good, resilience bad. It's just they're different. Right. So, and both can have a place in our discussions about how people recover from trauma. But unfortunately, a lot of times people don't understand the second concept, post-traumatic growth. They tend to at times conflate resilience with post-traumatic growth, and they're not the same thing.
And then, maybe being a little bit, I'm not intentionally obviously controversial, is I think a lot about labels. I think, just when I was 11 years old and get diagnosed with ADHD, right? And, you're a kid and you internalize this message, something's wrong with your brain and your brain's broken. And it's a lot, right? It's a lot to sit with and carry. And I think about that in terms of a combination of diagnosis and a disability system that often sort of rewards those diagnoses. I wonder about the importance of language. I wonder about the importance of frames, and then the importance of questioning the way we do things. Because I get it that, you go to a doctor and you're struggling with something in your arm, and they're like, there's nothing wrong with you, there's nothing wrong with you. Like, it starts to get incredibly frustrating when you start to feel like you're being gaslit, and it's like, it's in my head. And so there's some relief in like, oh no, you have tendinitis or whatever it is. But on the mental health side, where it's a little more subjective, I feel like there should be a greater examination and understanding of the relative impact of diagnoses and labels on people's perspectives for their future, their sense of agency, and their belief in what could happen. And I'm just curious your take and perspective on, I think there's nuance to all these conversations. It's not like, to your point, it's not good or bad. It's just, but I'm just curious your take on the labels, on what I would argue is, pathologizing everything, and kind of where you come down on all of that.
Yeah, I mean, if you think about, use your example of, a broken arm is a broken arm, right? If I break your arm right now, which I could, it's gonna, yeah. Well,
I'm weak.
Would you help
him break your arm?
No.
Oh.
Yeah. Anyway.
So a broken arm is a broken arm, right? A broken bone is a broken bone, right? So someone's reaction to a traumatic event is not going to be the same. So you have two different people, they experience the same traumatic event. They're not going to perceive it in the same way. Mm-hmm. So that's where labels get us into trouble in mental health, is that, I understand why we need labels and why we use labels in mental health. It's a language that doctors can talk to each other about symptoms, and we can try to put people into categories so we can, select the best treatments that we have to treat those particular symptoms. But when you're dealing with people, and you're dealing with the psyche, and you're dealing with personality, there's so much individual variability that labels aren't as useful as they are when it comes to making a cancer diagnosis or a broken bone. So again, it's not a negative reflection so much on the field. It's just where we are and what we do, and it's the best that we have, at least right now. But I think labels can be damaging, right? I think if you start putting people in categories, and they start to learn about those categories, which oftentimes are not very positive in nature. Right. The language around these labels and categories are not very positive. They start to take that on, right? Mm-hmm. And that starts to become part of who they are. And I think it's important as mental health professionals for us to take a step back and to truly appreciate and understand what we already know, is that there's a lot of individual variability in how people deal with life and deal with life struggles. So we treat the person and we work with the person. We don't treat the diagnosis, right?
Yeah.
Whereas a physician is going to treat the diagnosis.
Mm-hmm.
So
maybe at one point somebody labeled somebody else a Disney adult, and that was hurtful.
Not tracking that. I don't know if the Disney is that a thing.
We'll catch that in another episode.
Have you ever dealt with that from a...
I've never seen.
Just move on.
No.
Okay. So for you,
I'll be on the lookout for that.
When you think about the intersection of medication and therapy, and Josh kind of hit on this earlier when he asked, when you did learn more about PTG, how did you apply it to your work? And you're like, well, when I was in Iraq, I wasn't really doing that yet. That came later. But how did that inform your approach?
My training prepared me to look at people as a collection of symptoms, right? A diagnostic category. I don't really see people like that anymore. And I don't think I intentionally tried to stop doing that. It's just as I learned more about, again, the individual variability and how people respond to trauma, and how people's core belief systems are changed because of traumatic events, I started to understand their unique stories, their perspectives. Do I treat symptoms? Sure. Sometimes, people need help sleep. I give them a medication to help them sleep. Sometimes they need to process some emotional content so they're less distressed. So I do treat symptoms, but it's not so much now as a unified collection of your symptoms are like everyone else's, right? Mm-hmm. So I understand their story more fully, which lets me be a better clinician because I can tailor my interventions to their particular situation.
And Brett, I want to ask you a question, because one of the things that's interesting about post-traumatic growth is, of course, every individual experience and story is different. And then one of the things in post-traumatic growth terms is like the impact of those things is where you have, I think, some degree of universality, which is like, it affects this core belief system about what you believe about yourself, other people in the world. And one of the things we hear a lot of times from veterans who come to our programs, especially Warrior Path, is that they're so tired of talking about the event, of feeling like they're wallowing in it, and that they much appreciate the opportunity to reflect on not what happened, but the impact of what happened on them, on their life, on their perspectives, because it feels like it's starting to make progress towards what they really want, which is they want to move out in some direction.
Mhm.
And I'm just curious your perspective and take on that and how like PTG might foster that. Like there's less, I think about a prolonged exposure where you're just really focusing on the event, but not so much about the impact of the event on your beliefs, which then sets you up to a whole kind of series of consequences.
Yeah, I mean, that's the challenge with some of these manualized interventions is that it does focus on the event, and it does, again, the goal is to make you feel less distressed, right? And the goal is to if the treatment is successful, you have fewer symptoms on a checklist, and we believe that if that occurs. So if you go from a 40 on a survey down to a 15, that, maybe you no longer have the diagnosis, but what does that really mean? Does that mean you're cured? Does that mean you go off and live a better life? Does that mean you get along better with your wife or your spouse? Does that mean you're going to be yelling at your kids less? Does it mean you're going to experience more joy in your life? Not necessarily. It just means you have fewer symptoms on a checklist, right? So again, there's a place for these types of interventions. What I think is important is to help people understand that they can experience more. They don't have to. I think there's a kind of phrase, a diminished version.
Yeah.
I really like that idea. Is that you don't have to be content with just being a diminished version of your past self, right? Just to be a little bit better or returning to baseline. There is something more that you can achieve, but they have to know about it first. People have to understand that because they're not told that. They're told that let's focus on the event. The more we talk about the event, the more we write about the event, the more we, extinguish these symptoms, the better your life is going to be. And I challenge that because I don't necessarily know there's a direct correlation between fewer symptoms and a better life.
Well, I think I've been reading The Choice, Edith Eger's book, and I want to say something that was like standing out to me was I don't think it's that you ever weren't listening the right way or like really hearing what they were saying. I think maybe it was just listening a little differently. And she talked about that with, she had two different clients come into her office and one had just experienced the loss of a child and she was talking about that. And the next one comes in and she was talking about she had just gotten this new car and it was the wrong color and she was all distraught about that. And if you just put those two at face value, you'd be like, okay, well, I'm definitely not going to listen to this second lady or I'm going to have a much different kind of conversation with her. But she was like, I knew that wasn't what was really bothering her, that it was really triggering this core belief she had about herself that, she didn't deserve really nice things and that once again, she was kind of let down. And I think that's something that really stands out about the work that you were doing is you were always listening, but that you were listening for different parts of their story and really hearing maybe core things that they might not have been able to put words to, but that you helped them kind of be able to see, which is awesome.
Yeah, well, thanks. So that evolves over time. I was inexperienced. Obviously, as we start our careers, we probably think we know more than we actually do, and and especially as as people that go through years and years of higher education, you're supposed to take on that sense of I'm the expert and I know what's going on with you, but that's just not the case, right? So you learn to listen differently. And again, fortunately, I had that shock to my system because of the sergeant that said in his own way, shut up and listen to me. And I did. And then because of that, I listened in a different way and I think in a deeper way.
And Brett, you're involved in a lot of training of, mental health professionals. And I think about that. I think about like a younger Brett as you were studying. It's like, what is your hope? And what would you say to people? Let's start with people who are like kind of on their way into the career, but also people who, much like you, were like in it, but maybe they're a little bit dissatisfied. Maybe they're not seeing that the changes that they hope to be a part of are happening. Because of the nature of the approaches.
Yeah, don't forget about what it means to be a therapist, right? So I trained as an Adlerian at Alfred Adler, one of the early he broke away from Freud, psychodynamic guy. But
what's an Adlerian?
Well, it's someone that trained under the theory of Alfred Adler. He was a student, or actually not a student, a colleague of Freud. He was less about instincts and about how we were controlled by external forces, right? We had inside of us the ability to determine how things are going to be, right? So I want people to remember that the most important thing is stay with the basics, be a good therapist. Whatever trainings you go through, whatever interventions you're taught, again, those can be helpful for you, but don't forget what it means at the core to be a therapist, which is to be human and to be able to connect and to be to to connect with individuals on a deep level so that they believe that what is being discussed in that office is the only thing that's being discussed in the world at that point. That's how people change, is understanding that what they have to say is important and profound. And so the human connection, the deep connection, manuals can be good. Interventions and techniques can be good, but get back to your roots of being a therapist. Why do you believe people change? Why do you believe people grow? Why do you believe people struggle? Don't necessarily understand that from a theoretical standpoint. Understand that from your experience as a person in working with other people and in your own experiences. Why do you think people grow, change, struggle? Be a human.
Yeah. Well, that's good advice. Be a human. Yeah. I feel like there's so many lanes that we're going to go down with you, especially as we continue this series and more of these podcast conversations. I'm just grateful for the lens and the perspective that you provide, and just grateful for however it happened with that sergeant. Is that what you said? In Iraq, which just kind of set you on a different path. But just grateful that, like I said, that you did something with that experience and didn't let it just be, it could have just been a learning moment and you continued as you had been, but that it really led to all these other open doors. So I'm excited that you brought us another layer in our PTG foundation, and that there's plenty more still to build from here.
I'm glad I could be a part of it.
I'm just grateful I didn't break my arm.
Me too.
But I could.
I could.
I'm grateful you didn't call me a Disney adult.
Yeah, he's going to go Google that. So he's going to email those folks as well.
See if they will respond to me. Change my life.
Exactly.
Yeah.
Thanks, Brett.
Yeah.
Thank you.
Appreciate
More to
it.
come. See you next time.